Coming up in today's show, for all of you weekend warriors, we'll be talking about common sports-related injuries and then how to avoid them. Welcome back to 12T Health. I'm Dr. Derek Da Silva. It's summertime. Maybe you've been sitting at a desk all week, and then the weekend rolls around. You want to cram all the activity you've missed out during the week. Things like biking, hiking, swimming, tennis, golf, etc., all into one day. This scenario could result in injuries, both minor and more serious. We want to tell you how to prevent that from happening. My next guest is Dr. Dhimant Balar, Director of Sports Medicine for the Human Motion Institute at Raritan Bay Medical Center. Welcome to the program.
Great, thank you for having me.
So people do this all the time, right? I mean, they go out and they want to do everything in a day or two. Present
company included.
Yeah.
Absolutely, absolutely. It's a very common thing that we see in or at least in my practice. It's we call it the weekend warriors, if you will, but actually overuse injuries extend all the way down from pediatrics as well. And
no, go ahead. I'm sorry. Keep going. Yeah. So pediatrics also?
Absolutely.
Well, because children are not as active today?
No, because they're active and in fact more active than they used to be. There's more than one baseball team. They're playing on 3 baseball teams. They're playing on soccer teams. They're doing karate. There's no time for rest.
I see. So how, you're talking about rest. How do we pace ourselves during a weekend like this? And it isn't just sports activities. It could be gardening. It could be work that you need to do around the house. I mean, there's a lot of other scenarios involved in this.
Absolutely. It involves multiple factors. The most important thing that I tell my patients, they have to listen to their bodies. Okay? If your body is not used to being active every day, if you're used to sitting in a chair at a desk for 5 days a week, and all of a sudden, as you mentioned, during the weekend hours come, you want to play basketball, you want to play the football, or go out for hikes or bike rides, now you're exposing your muscles to 150% of activity than they're used to. Mm-hmm. So that's when they are more optimized, or there's more of a chance for overusing the muscles that you're not used to using and increasing the chance of injury.
What are the more common injuries that you see?
Well, it depends on sport. These days with football camps starting, a lot of the football injuries that I see in my practice or we see in our facility include knee injuries, ligament injuries, sprains, sometimes meniscus tears. Also very common are ankle injuries, which can exist for the common person as well. Mm-hmm. Ankle injuries are very big in the summer because people are generally more outdoors, they're picnicking, they're out playing tennis, et cetera, et cetera.
So prevention, let's talk about that because this is important. There was some data that came out a couple of years ago that said you shouldn't warm up, that you should mimic the sport. For example, you shouldn't, not warm up, you shouldn't stretch, excuse me. You should do the activity of the sport you're going to do. So, for example, if you're going to play tennis, you just do that motion. If you're going to swing a golf club, what are your thoughts and what are you telling people to do today?
Well, the data that you're referring to in terms of stretching is controversial. You never want to stretch a cold muscle. It increases the chance of injury. So what I tell my patients is precisely what you just alluded to: warm up in the exercise you're going to perform in. For example, the whole idea of warming up is getting blood flow throughout your body. So whether you're in the gym and you want to start doing a chest workout, you start warming up on an elliptical machine just to get the blood flowing to different area groups, and then you begin stretching. Mm-hmm. Right? So the concept that I stress to my patients is never stretch a cold muscle. Always warm up, whether it's light jogging, if you're playing soccer, forward jogs, backward jogs to get in the motions of sport that you're going to use in the sport itself, or whether it's getting on the elliptical machine and just moving every part of your body. The key is getting blood to flow to the muscle groups.
I love the idea of the elliptical machine. That's one of my favorite things to do. And we even see them on sidelines at football games and things like that they're doing that. One of the more common things that I see in my practice, as a primary care physician, are shin splints. What are shin splints and can we prevent them?
You absolutely can prevent them. Shin splints, or in our terminology, medial tibial stress syndrome, is basically when the tendons and ligaments and the surrounding bone get inflamed. And they get inflamed from overuse or tight muscles, particularly calf muscles, hamstring muscles, and the muscles in front of the shin bone.
So again, is it stretching?
It's a combination of stretching and modification of activity. For example, if you have a runner or if you have someone that's a novice and wants to start exercising and running to lose weight, it's the moderation of their activity increase. So you never want to start running 3 miles, 4 miles if you've never ran before. It's getting your muscles and body used to that type of endurance. So it's gradual increase in activity. So shin splints, the treatment for it or prevention is modification of activity, gradual increase, proper shoe wear, and proper technique.
One other thing, Human Motion Institute. I've been on staff at Raritan Bay Medical Center for 28 years. And what's going on at the Human Motion Institute? I've heard a lot of good things about it.
Well, it's a program that the hospitals created for our patients and public to basically optimize their health care. We want to get them to the proper care that they need and facilitate themselves in getting back to their active lifestyle. The Human Motion Institute is actually composed of various specialties, all designed to put the patients first.
And they can call the hospital to get more information?
Absolutely.
And they will connect you to the Human Motion Institute. Thank you for joining us.
No problem.
Keep up the great work. My pleasure. Stay with us. When we come back, I'll